and welcome to the COVID-19 talks with local health authorities. I have with me Dr. David Persse, representing the City of Houston, Dr. Umair Shah, representing Harris County. This is sponsored by the Rotary Club of Houston. Thank you to past President Kathy Finninger, who provides us with questions. My name is Stephen Williams, Director of the Houston Health Department. Okay, let's start off with something that we both wrestled with earlier. Houston Methodist Hospital used Viptaville, RL-100, and saw a rapid recovery of patients on ventilators and those with severe medical conditions after 3 days of treatment. It seems official approval takes so long, and I'm sure doctors have some way to share success stories. How does a protocol like this get circulated amongst hospitals before it's officially approved?
Yeah, well, and obviously David and I are not experts on this drug, so let's to put that out there. But this is really a new therapeutic. It's actually been around for, it looks like, decades, but it's really a new therapeutic in the fight for COVID-19. And it's what they've done is they've had about 15 patients across the globe that they've used this drug on, and it's been in compassionate use. Okay. And they've been able to see that, for example, the patient they were describing at Methodist was able to come off the ventilator sooner. And so now whether they would have come off anyway or not, that we don't know.
It's compassionate use.
Exactly. So. And so right now it's very early in the process. I mean, they were talking about it was in phase 2 trials. But I will tell you that this is an example of newer technologies, a lot of science that's going into how do we fight this pandemic across the world, and because this company is out of Switzerland, and the fact that there is evolving evidence and information that we're going to continue to be getting information about, and until we know, we're not going to be able to say. So the way it generally works is compassionate use can allow for it to be used in certain situations, but then it still needs to go through trials and other activities before it's actually used as a...
The one thing about the way this question was asked is that this was used in compassionate use. So by definition, what that means is these are people who are expected to die anyway. So they're very, very critically ill. So the fact that there's a couple of successes is very encouraging. Yeah. Because the drug is already FDA approved and out there for a different use, physicians could potentially use it in an off-label, which means the physician is now 100% responsible for what happens in the use. But then, as you get, in order for it to become on-label, now the drug company now has to go through a whole bunch of hoops. But really, what I've seen over the years, like for example, aspirin, is used for all kinds of things. You read the labeling, it's only for what the FDA allows it for, but people use it, and doctors advise it for a whole bunch of other things. And that's all off-label use, so it may get used more quickly.
That's good information. This is a message that came in already. I'm getting somewhat paranoid because my wife always buys takeout food from Chick-fil-A or McDonald's, often served by young, often high schoolers there. And there's some reference to the family composition of those folks. And he's wondering, are this group of high schoolers more likely to be super spreaders without symptoms? Am I paranoid or realistic? Is there a greater risk that my wife is willing to acknowledge? She really likes the McDonald's and Chick-fil-A. That's
No, that's one problem, right? So I would answer that yes and no in terms of the paranoia. So yes, in that we are seeing, and we just talked about this in the last hour, a significant increase in the amount of viral activity amongst the people between 10 and 19 years of age. And for those that are working in the fast food restaurants, that is a population slice that is where the virus is really sort of taking off. Now, the flip side, though, is that we have not seen, and correct me if you know differently, we have not seen a lot of people become infected from food that they've eaten that may have been contaminated. It still seems to be predominantly respiratory. So if you're going through the drive-through and you're wearing a mask and they're wearing a mask, not likely that that teenager in the Chick-fil-A is going to infect you. If the concern is about being eating the food, I've not heard much of the touch.
Food is supposed to be, from all the evidence is supposed to be safe from that standpoint. But I do think it brings up another point, which is about wearing the mask. Which, if you have a consumer, or you're a customer, and you go into a business and you see the workers not wearing masks, which they should be and they're required to, if they're not, then that is where you would want to go to the manager and say, hey, your people need to wear masks, because that is the protection that also allows for us to say, look, you're interrupting potential transmission. And yes, you're right about the food, but we want to make sure people are wearing masks as well.
Yeah, you can go to the manager and just walk out. If everybody starts
That's
to
another
walk
way of doing
out,
it.
you
That's
know,
right.
I think
That's
pay
it. Yeah,
attention
vote
to
with
that.
your feet.
Yeah,
That's
make,
right.
make sure they know while you're walking out.
Yeah.
That's right.
Okay.
Yeah.
My wife's good about
Tess,
that.
This is carried over from last week. If you are in hospital for a non-related ailment and happen to be test positive, is that counted as a COVID hospitalization even though that's not why you went to the hospital?
Good question. I
Yeah.
don't think it is, though.
Yeah. Well,
Like so everybody who goes into the hospital is being tested basically on admission.
right.
So what I'm understanding the question, if you initially test negative, then during your hospitalization you test positive, I would think that that would not be counted as a COVID hospital. I'll have to ask our EPIs.
Yeah, but on the flip side, if somebody doesn't get tested on admission, gets
Right.
tested during the hospitalization, and they're positive,
Well, I
we'll
think
have
that
to
the
check that.
disease process probably needs to be one of the.
That's right.
Like if you go in with a broken ankle.
That's right.
And you have to get it
Yeah,
operated on.
Exactly. That should not count, but if somebody goes in with a respiratory illness,
That's right.
initially thought as pneumonia, bacterial or something else, and then they test positive,
Yeah.
that would then be classified as COVID.
Another carryover from last week, and this is about scammers and impersonating contact tracers. I'm just going to go ahead and answer this. No contact tracer will ever ask for a credit card to pay for a test to be sent to you.
Yeah.
Right?
Absolutely not.
That's
No,
right.
no.
Okay. If someone is placed on a ventilator for COVID, what percentage can get off it successfully?
The last I heard was about 20%.
20%.
Yeah, I would say it's
pretty low.
15, 20. Yeah.
Yeah.
Okay.
That's
If
right.
we must leave home in an emergency flood, chemical
Hang on.
release.
Can we back up there? Because this came up in an important conversation we had yesterday. If your family member is at the point where the doctors are recommending that the patient be intubated and put on a ventilator, the ventilator, because of the high mortality associated with it, is not the ventilator that causes the high mortality. It's that the doctors are telling you this is the last ditch effort because the doctors are doing everything they can to avoid putting people on ventilators right now because we know they do poorly. But they don't do poorly because of the ventilator. They're doing so poorly from the disease. This is the last ditch thing. They didn't want to do it. Now this is their last chance. And so don't mix the message there to thinking that intubation or ventilator is dangerous. It is, they're still trying very desperately to save
right.
that person's life.
That's a good point.
That's a great clarification.
Yep.
It's not the ventilator that's causing the death.
That's right.
That's right. Yeah.
Okay. If we must leave our home in an emergency flood, chemical release in the air, et cetera, is it safe to go to a shelter the city or county sets up?
Well, assuming that's because of COVID, the question is related to COVID, and the answer would be yes, because we're going to do what we have to do in order to protect the people that are coming into those shelters. Now, we haven't figured out if we're going to be able to completely determine who's COVID positive, because you've got people, you're going to have screening and those kinds of entry activities, but not necessarily testing, because that will be not feasible. So that's going to be something, but absolutely it's going to be safe to be at the city or county shelters.
Thank you for joining our COVID-19 talk. We'll be right back.
Let's go see your room.
What do you think? We kept it a little spare, so you can decorate it how you like.
Dinner. Go.
Excellent. Soccer is fun. Yeah, I saw you guys out there. We're the family.
Yeah.
I thought you were on my team.
back to the COVID-19 talk with your local health authorities. Should school evaluate their air conditioning and ventilation before opening?
Well, I think yes. I mean, I think we want to make sure that schools do a number of things. In fact, we're going to have some guidance that's going to be on the Reddy Harris website that will include some steps that schools should be taking. I'll tell you, there's a lot of things that schools need to be doing, and they're starting virtually, which is great. But at some point, if they make a decision to go in person, then we want to make sure they've taken those steps in advance.
The definition of a child seems to vary from 0 to 14 or 0 to 24. What is the definition in Harris County and Houston so we can understand the reporting results? I'm not so sure that that's the case.
Not
with
sure
COVID.
that's.
So
We do have our on the case piece on the website. We have on the dashboard we have 0 to 9, and we have 10 to 19. So we do have those, but we're doing it 0 to 9, 10 to 19, 20 to 29, and so on and so forth. We do have that designation, and typically it's usually up to age 17, and then there are some times where you have 17, 18, 19, depending on the scenario. But yeah, I've not heard 14 as being a definition that's in there.
This is a perennial question we have all the time about, is it driving age? Is it when they get out of school? Is it legal age? I mean, this is a problem. Yeah.
And usually that distinction is made in some of the other fields like juvenile justice.
That's right.
Whatever.
Right.
97,000 children in the U.S. tested positive in the last 2 weeks of July. American Academy of Pediatrics says that there was 90% increases in cases amongst U.S. children over the last 4 weeks. Is this due to more testing and preparation for a return to school?
That's a good question, and we have seen an increase in testing. So I don't know. I mean, with kids not getting terribly sick, there wasn't a lot of testing of kids going on, a couple of months ago. So this may be an artifact of increased testing. That's a possibility.
Yeah, I did reference that article yesterday at the press conference, American Academy Pediatrics, and it's hard to unpack is it more testing or what, but we also recognize that there's also more attention that's being given to kids, including in some instances more kids that are now going back to certain activities, whether it's camp or whether it was something in the summer or whether it's school related. And so that congregation we do believe is a risk. And so it's not just about more testing, it's actually about the congregation of activities.
And this also illustrates where things like positivity rate may be more helpful. But even with positivity rate, you still have to have a critical mass, a basic amount being tested.
Right.
The World Health Organization says most cases so far between 25 to 64-year-olds and cases of very young children and babies have increased 7-fold. What are you seeing locally?
We just talked about this.
Yeah, so we're seeing an increase in the numbers in our younger population. We're particularly 10 to 19 is the age. We're also seeing, and we think some of it is related to socioeconomic factors, poverty, things of that nature. Communities that are disproportionately impacted are Hispanic communities, our African American communities, and it's been really hard to unpack this. How much of this is because of race, ethnicity? How much of it is because of poverty? And the answer is probably there's some of both that comes into it. So we are really working hard with our partners at University of Texas School of Public Health and other academic partners to really unpack the data as best we can.
Trying to compare week-to-week positives is so difficult. Numbers in Texas are going up and Houston is decreasing. Testing is less. What's the takeaway?
Well, I think the takeaway locally is that what Houstonians are doing is working. So wearing masks, staying away from mass gatherings, washing your hands frequently, those things are working locally. Now across Texas, particularly in the valley, there's a lot of viral activity going on. So when you look at the state numbers, it's not a surprise that their numbers are going up. But if we want to focus locally, then wear the mask and do everything that we're doing, just do it more and keep doing it. Don't stop doing it.
Yeah, and my concern is that we are going to start to see this decrease, and we're going to lull into thinking we don't need to do these things.
Right.
This should be the new norm of behaviors for us for a long period of time until we have a definitive treatment, because otherwise we are going to see this increase come back. Yeah. And unfortunately, it's going to come back at the time of flu season, and that's going to be a real problem.
Yeah, a couple of things that hopefully won't change. One is that the virus isn't going to change and become more transmissible. It already did that once. Hopefully that won't happen again. But unfortunately, it's not going to go away.
Yeah,
right?
That's right. That's
right. So do you think the continuation of wearing masks will help with flu?
Yes.
Oh, yeah, yeah.
Oh, yeah.
Well, and so I've sort of made a prediction recently in a couple of conversations. I think that this coming fall season is going to look one of two ways, and it's not going to look in between. It's either going to look really good. We've got good control over COVID. We got good control over colds. We got good control over influenza, all those viral things because people are doing the behavior. Or we're going to get complacent, like you just said. We're going to not do the things we're supposed to, and it's going to be terrible because then you're going to have people thinking that they have a cold when they actually have COVID, not taking any precautions because, oh, it's just a cold, letting COVID spread even more. I think it's going to be one of the two extremes.
And I'm going to say something controversial, Stephen. Election season is coming as well in November. And there is the politics that's been playing around this pandemic fight throughout this country. And that is also going to have a nature of it, and we can't predict how that's going to play into this, unfortunately. But I do think it's important for us to acknowledge.
I hear you. I keep hearing people who tested positive say they are having very few issues in getting better quickly. Are symptoms decreasing or asymptomatic cases increasing?
I haven't seen any data about the asymptomatic. I mean, I have seen that 40 to 45%, almost half are. In fact, I actually saw a report that up to 70, 80% asymptomatic. Now, they were defining asymptomatic as even mildly symptomatic, but
with more testing, so we may have more people who are asymptomatic being tested now and being surprised to find out they're positive when 2 months ago they didn't even go to get tested, right? This is people who were asymptomatic back then. So that may account for some of it. But the other thing is that many people are asymptomatic. Many people who get symptomatic do well, but there is growing research on the folks who are not getting well very quick, or they weren't terribly sick, but they just can't get rid of their symptoms for months.
Do you want to make mention of your comment from the press conference about these are not long lines to get tested? We want people to go and get tested.
Yeah, locally we have tremendous capacity for people to go and get tested. We've not only increased the number of testing sites and the number of tests available and the hours, but also the number of people who are taking advantage of it seem to drop off. So if you want to get tested, you go to a testing site, you're probably going to get in and out very quickly, and you're going to get your results far more quickly than we've been hearing about over the past months.
That's right.
Yeah, explain the difference in the time limit and results. There are some changes that both entities have made.
That's right. It used to be, with especially the federal sites, we were looking at 2 weeks. Now we're looking at 3 to 5 days at the top end, and so we're really trying. I actually got a report from somebody who said that I got my test results actually back the same day, and somebody that said I got it back the next morning. So there's a lot that's changed here, and we want people to take advantage of getting tested. It's free, and guess what? It's easy.
Thank you for joining our COVID-19 talk with local health authorities. We'll be right back.
Wash, washy, wash, washy, wash, wash your hands. Scrub them while you sing this song. Wash, washy, wash, washy, wash, wash. Rub your hands and fingers and the places in between. Using soap and water makes your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1, now dry.
Wash your hands for 20 seconds, just like Elmo.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Respond to the upcoming 2020 Census survey online, by phone, or by mail. A complete count of all Houstonians helps our city secure federal dollars for roads, schools, healthcare, housing, and disaster recovery. By answering just 9 questions, your voice will help shape how Houston is represented by state and federal officials over the next 10 years. The census is easy and everyone counts. Your responses are safe and confidential. For more information, please visit 2020census.gov.
Welcome back to COVID-19 Talk with local health authorities. Can you explain the significance of the latest finding of the University of Florida virologists who showed proof that floating Respiratory droplets called aerosols containing live virus can spread as far as 16 feet.
Yeah.
Samples collected from COVID patients in a very sealed hospital room with all the scientific protection possible, yet the virus were cultured from the air at that great distance.
Yeah. So I read this article, I know this article, and this was actually really congratulations to the authors of it, because they came up with a very ingenious way of doing this experiment to see whether or not live, potentially infectious virus would remain in the air and how far away it was. And so a totally new technique. It was very ingenious. And unfortunately, what they were able to show is it confirms the idea that there is aerosol spread of the virus. And so, it raises the question then of, is 6 feet far enough, is really the bottom line. And so 6 feet may not be far enough, but we've not seen any change in the recommendations. But in this study, yeah, it was in a hospital room, and the patient, they measured it, I think, at two distances. I can't remember what the short distance was, but the further distance was 16 feet, and they measured it just as much at the closer distance. Yeah. So proving that it gets in the air and it floats. And,
and what I then say is, that's why you both have to wear masks, and we want to have a situation where you're as far away from each other as possible, at least 6 feet. Doesn't mean that I can only be 6 feet apart. I can't be 8 feet apart or 10 feet. Yeah. You can be even further apart, but at least 6 feet apart, but wear your masks.
You know, I steal from my public safety background, and when we talk about radioactive exposures, it's a time, distance, and shielding, right?
Yeah, that's right.
So if there's a radioactive source, you want to be far from it, you don't want to be very, very, very long, and you want to have, a lead shielding. It's the same thing with this virus.
Yeah, you're right.
Time, distance, and shielding. It's the same three things.
That's right. It's all about exposure.
In theory, when a child gets whooping cough or measles, they stay home. So will it not spread? Will COVID join? And we talked about this earlier, on this symbiotic relationship and reduce other diseases, resulting in perhaps a light flu season.
Yeah, we did talk about it. Yeah, I'm hoping so.
Yeah. I mean, the thing is that I think a lot of people have forgotten that coronavirus, the family, this is not the influenza family. So there is that piece of this that we do have to recognize. But I mean, we are hopeful that there are some ways that there's some ability to give a COVID vaccine, give a flu vaccine. There's uptake of it. People take the vaccine, and we actually have a way to fight both at the same time.
Some studies are showing antibodies are almost undetectable 2 to 3 months after people are symptom-free. And the milder the case, the quicker they dissipate. At that point, do you think they are able to be reinfected?
So there is interesting question. So that's the humoral immunity part of our immune system. And then there's also cellular immunity, and this is where the helper and killer T cells come into play. And so, yeah, there's a lot of evidence that the humoral, the antibodies, may dissipate in as little as 3 months. There's also some evidence that people have become symptomatic again. There's a question as to whether or not it's a reactivation of the initial infection or if there's actually a true secondary infection. But what we're learning about now is the humoral immunity and the part that plays. The cellular immunity and the part that plays. And so it's hard to give a definitive answer to that, but right now there is evidence to suggest that people, yes, they can potentially become symptomatic again after 3 months.
Okay. A recent article mentioned animal reservoirs that could keep infecting humans and theorized that small animals could serve as hosts. Does that mean rats rather than cats?
I haven't read that article. Yeah. We have a lot of zoonosis and veterinarian folks that we could punt that question to. I will tell you that we are seeing some increased cases, not a ton, but anecdotal information that you might have individuals who are testing positive who can actually pass it to their pets, but we haven't necessarily seen it the other way around, and that's good news, but again, it's evolving.
So the other good news is Texas A&M is actually working on this question right now. They just recently did a study where they were able to actively infect some cats. Now the cats became minimally symptomatic. A couple of them, as I recall, had no symptoms, and one or two of them, I don't remember the exact numbers, had they sneezed a few times. Very minimal symptoms in the cats. But then you're right, the next question is, can the cat then turn around and infect a human? And they're working on it. So.
Yeah.
Oh, you said Michigan. CDC says in Michigan, the number of 5 months old who are fully up to date on their vaccines fell from 68% to 50%. And in many states, this could be due to closing of doctors' offices. How are we doing locally, and shouldn't we include reminders about this to parents?
Yeah, well, locally, we talked about actually just this morning, we are worried about the catch-up in the vaccines and kids especially, but also adults that have fallen behind on vaccinations. And so this is if we have not given the reminder, this is a great reminder that we know that healthcare systems and offices have been disrupted throughout this pandemic, but this is a time for you to remember to get your vaccination and not just think about, hey, maybe I will do it in the future. This is the time to do it, especially with back to school and then on, incoming and ongoing flu vaccine.
Yeah. The perfect storm would be influenza, COVID, and measles.
Oh my gosh. And a hurricane.
Well, that might happen sooner than later. The U.S. has sent 2 million doses of hydroxychloroquine to Brazil for clinical trials and as a prophylactic. What do you know that we don't? Has anything changed with our U.S. protocols?
I don't think so.
Not from our standpoint. And I'm continuing not to recommend hydroxychloroquine from my standpoint. I don't know what your stance has been.
Yeah, it's not been shown. I mean, I'm glad there's still studies going on, right? Because we really need to put this controversy to bed. But at this point, there's no evidence that shows that it's helpful. I have been involved with a couple of cases where people are desperately clinging on to the belief that it's going to save the day. And I think that's a real disservice to folks.
Yeah.
The only virus that has been eradicated by vaccine is smallpox. A recent article says COVID will be around for the rest of our lives. Your comment. It's here now.
Well, I'll tell you, this is the reason I went into public health with smallpox eradication and the WHO and all the different activities that are related to that. And I will say that we don't know how long COVID is going to be around with us, but it's likely going to be around with us for a long time coming. Now, the question is, how do we react to it, or how do we act towards it, or how do we actually defend ourselves from it, not just today, in the future, months, years, et cetera. And that's really a lot that the chapters have not been written yet.
So I'm going to say the cynic in me thinks it's going to be around for a long time, even if we get a really good vaccine. And the reason is, yes, we eradicated smallpox, and we've largely, but not completely, eradicated polio. But the difference between smallpox, polio, and COVID is that smallpox and polio had devastating impacts on a large percentage of the people who became infected. And so there's this huge desire on the part of the public to get rid of it. With COVID, with so many being asymptomatic or minimally symptomatic, I don't see that fire in the belly of the public around the globe, because you have to get it completely around the globe to eradicate it. So I'm a little bit more cynical about it because of it's the anti-vax mentality.
Yeah.
It's going to derail it.
Okay, I'm hearing about clinical trials on antibodies. Please explain the difference between natural and monoclonal.
You want to?
Yeah. So we. So I don't know if I'm understanding the question properly, but there are ways to create antibodies, and we use those in certain illnesses where we actually administer the antibodies to folks because their body hasn't produced them yet. They've been very successful. They're not 100%, but they're very helpful. And if somebody's critically ill, if it's me or my family member, yeah, I'm good with it.
One last question, and we're under a minute. Remdesivir was issued as an emergency use authorization by the FDA. Moderna is making 1 million doses of theirs. Anything other positive news? And have you heard about Sputnik 5 from Russia?
So we've all heard about the Russian vaccine, and there's a lot of question about is it truly what they promised? So that's one issue. There's also, I believe Glaxo is working on in India a vaccine development as well. So I think there's a lot happening across the globe, and of course happening here in the United States, including locally. And so it's just stay tuned at this point, because everybody is racing to find the vaccine that's going to help us hopefully get out of this, because right now all we have are masks and distancing and washing your hands, and we want to have that silver bullet as best we can.
Any closing thoughts?
Wear your mask and keep it up.
Yeah.
We're moving in the right direction because of what we're doing, so keep it up. Don't stop now.
Yeah, my closing thought is that I'm just appreciative of the Rotary Club and Steve and you and David just to have this for months now, and hopefully it's been helpful to all the viewers.
22 weeks.
Wow.
Thank you for joining our COVID-19 talks with local health authorities. Dr. David Persse representing the City of Houston, Dr. Umair Shah representing Harris County. Thank you to past President Kathy Finninger of the Houston Rotary Club. My name is Stephen Williams, Director, Houston Health Department. See you next week.